Ear infections are one of the most common childhood illnesses. They can be very painful, keeping both children and parents from a good night's sleep. So how do you help your child if he or she wakes up during the night with ear pain? We hope to help you recognize when your child has an ear infection, relieve the ear pain, and determine whether your child needs urgent medical care or if you can wait until morning to call the doctor. Before we talk about how to reduce the pain for your child, let's take a look at what causes an ear infection. The ear has three parts: the inner ear, the middle ear, and the outer ear. Ear infections often occur in the middle ear. They usually start with a cold, which causes swelling and inflammation in the eustachian tubes. The tubes get blocked and fluid is trapped in the middle ear. The fluid may become infected, causing the ear pain your child feels. So how do you know if your child has an ear infection? He or she may complain of pain or pressure or a clogged ear. If your child isn't old enough to explain it to you, look for other signs, such as tugging at the ears. It is a good idea to check your child's temperature anytime you think he or she may be sick. If you use an ear thermometer, be sure to take the temperature in the ear that is not causing your child pain. A fever of 100.4 or higher can be one sign your child has an ear infection. Other signs include increased fussiness, difficulty sleeping or lying down, a change in appetite, or a temporary loss of hearing. Even though ear infections can be very uncomfortable, they're usually not serious. You can almost always wait until morning to call your child's doctor's office or clinic. There are several reasons your child's medical home is the best place to get treatment for an ear infection. First, the staff will know your child and his or her medical history, having all of the records on site. They will be able to help you decide if your child needs antibiotics, discuss preventing another ear infection, and determine whether your child should see a specialist. You will also be able to avoid long waits at the emergency room. And if you have a copay, it will be higher at the ER or urgent care center than at your child's medical home. Before you call the doctor, there are several things you can do at home to help relieve the pain of an ear infection. First, give your child an over-the-counter pain reliever like ibuprofen, often sold as Advil or Motrin, or acetaminophen, often sold as Tylenol. But remember, do not give ibuprofen to children younger than 6 months old. You can also apply a cold or warm pack on your child's ear, whichever is most comfortable. Prescription numbing drops contain an anesthetic that can relieve the ear pain your child is feeling. They do not prevent or stop an ear infection, but they can make it feel better. Today, we will give you a prescription for numbing ear drops. Please fill it and keep the bottle in your medicine cabinet so you can use the drops right away if you think your child has an ear infection. When you give your child drops, have him or her lie down with the painful ear up. Warm the eardrop bottle by rolling it back and forth in your hands. Pull the earlobe up and back and fill the ear canal with the numbing drops. Your child should feel some relief within 5 to 10 minutes after using the drops. You may use the drops every 1 or 2 hours as needed for pain. Do not rinse or wash the dropper after use. Store the eardrops at room temperature, away from light and heat. There are some cases when you should not give numbing drops. Do not use them on a baby who is younger than 6 months old, unless it's under the doctor's advice. Do not use drops if your child has ear tubes or has pus or blood draining from the ears. And do not use drops if your child has had an allergic reaction to antipyrine or benzocaine. There are some rare times when you should not wait until morning to call your doctor's office or clinic. If your child has a stiff neck and cannot touch the chin to the chest, is having a hard time breathing, has difficulty waking up, seems disoriented, looks very sick, or is dehydrated, call your doctor immediately. In addition, anytime your child has a fever of 105 or higher, do not wait to contact your doctor. Or if your baby is younger than 2 months old, call your doctor if a fever reaches 100.4. And in case of a life-threatening emergency, call 911 right away. We understand that it is difficult to have a sick child, especially if he or she isn't sleeping, but it is important to remember ear infections are rarely serious, and they often get better on their own. It just takes time. Hopefully, this information will help both you and your child deal with the pain of an ear infection.